Hello, I'm Dr. Barry Pecos, York Region's Medical Officer of Health. The exciting news of the availability of the bivalent vaccine for York Region residents means that my message is a very hopeful one. The vaccine will provide excellent improved protection for the most vulnerable in our community now, and by September 26th, it will be available to everyone. This vaccine will help protect not only individuals, but the entire community from a fall surge of COVID-19 and put us in a good position to finally put this pandemic behind us. I strongly encourage all those who are 70 or over, immune compromised, pregnant, or Indigenous people to get vaccinated as soon as you're eligible. While the province has recommended a 6-month interval since your last booster, you can get it as early as 3 months. You can book an appointment to receive a bivalent booster dose at york.ca/COVID19 vaccine or call Access York at 1-877-464-9675. York Region Public Health is actively reaching out and helping to ensure that those in long-term care, retirement, and other facilities are receiving their bivalent booster. Healthcare workers of all kinds are also eligible, and I highly recommend that they get their bivalent booster, particularly those who work in facilities or with elderly or immunocompromised people. We have received many questions from residents asking for clarity on the bivalent booster dose and whether it's best to get it right away or to wait for the winter to come. Our advice to all residents is to be as updated as you can be with your COVID-19 vaccines. This means if it's been 3 to 6 months since a previous dose or since a COVID-19 infection, you should book your appointment right away to receive the important bivalent vaccine. This provides protection against the original strain of COVID-19 and Omicron BA.1 variant, as well as other variants. This provides you with optimal protection from severe infection and hospitalization, not only for you, but for others in the community. If you want to read more about the available vaccines and their benefits, visit york.ca/COVID19 vaccine info. Now that I've shared the exciting news about the bivalent vaccine, I'll share an update about our status in York Region. We continue to see our wastewater signal plateauing, but like our hospitalization numbers, they remain persistently high, much higher than we would like to see at this point. This means that COVID-19 is still circulating at relatively high levels in our community, and unfortunately, we still see real hospital capacity strains. Fortunately, the number of outbreaks we're dealing with in long-term care and other congregate settings are decreasing. Also good news is that school has started and is almost entirely back to normal. Most children have been protected through vaccination, and we continue to have 5 to 11 and preschool children coming in to get their shot to protect themselves and classmates as well as teachers. With COVID-19 still very present in the community, please remember to carry a mask to use if needed. While cases are trending downwards, they are expected to climb again with kids back in school and all of us increasingly moving indoors in the fall. Please heed the sound advice to remain home if you have any COVID-19 symptoms until they have cleared for 24 hours and wear a mask in public for at least 10 days following an infection. It's always been a good idea to stay home if you have any symptoms from any transmissible infection. You may have heard that some world leaders have declared the pandemic over, and no one could want it over more than myself and colleagues at Public Health. But a pandemic refers to the spread of disease, the prevalence of disease, and ongoing impacts like hospitalization and death, and most importantly, ongoing uncertainty and the need for preparedness and action. York Region Public Health continues to monitor COVID, to provide vaccines, to meet community needs, to manage outbreaks, and plan for the fall. Our goal with COVID-19, as with everything we do, is to promote health and protect against illness, and to do this in a way that is efficient, effective, and integrates seamlessly in the community. Looking forward, we continue to manage the pandemic and look forward to a state of endemicity, perhaps later in the spring. For now, it's unclear what the fall and winter may bring. We do know that vaccination is our best defense against the virus, and I know many York Region residents are looking forward to the availability of the bivalent vaccine for anyone over 18 years of age. This will happen on Monday, September 26th, and we've increased our vaccination capacity to ensure that you can get an appointment when you need one. To all those in York Region celebrating the Jewish New Year, Shana Tova Tichatenu V'Tichatenu. I would also like to recognize that we will be celebrating our National Day for Truth and Reconciliation on September 30th. Both these occasions are opportunities for thoughtful reflection about the past and the future, and our individual and collective responsibilities to each other. All the best.